Hi, this is Mark Weil. I do natural medicine in San Francisco, and I'm going to talk about alternative ways to deal with bladder infections, urinary tract infections, and bladder frequency or urgency. So most women that have had, and this is addressed mostly to women, although it will work for men, most women that have had a bladder or urinary tract infections have had symptoms that are usually what we'd call recurring. So they're more chronic, and that's what we're addressing. This will also work for acute symptoms and something that hasn't reoccurred very often. So if it's happening once every year or two, that's clearly not as recurring as some people that are having them every time they have sex or every time they're under severe stress. So it seems that bladder infections are dealt with regularly by antibiotics, which is the common thing. Cipro is one of the common ones. It's not necessarily the only one. And a lot of the alternative methods have used mostly cranberry juice or cranberry pills and or uva ursi or shaved grass, whatever is appropriate. So for anyone that's had any of these things, and especially on a recurrent nature, especially if you're having blood in your urine, obviously seek medical help. But if you're watching this, I'm assuming that you've had some of these symptoms and you're trying to find an alternative way to deal with this. The main thing I do with people is I start to change the pH, and I'll explain why. So if you get people's pH from a little more acidic or very acidic to alkaline, usually pathogens don't replicate or grow as quickly. So if you've had a recurrent infection and you know what they're like, you also know that seems to be sexual activity will set it off, stress will set it off, eating badly, not getting enough sleep, not eating often enough, not hydrating. Those tend to be the things that make it worse. Well, what usually happens is all those things will make you acidic. Now, people say sexual activity doesn't make you acidic. I'm not talking about it in that way. But if your partner is really acidic, that acid can affect your body. Plus you have increased friction and you have some minor tissue irritation. So anytime you have inflammation or tissue irritation, that will be an acidic component. And if you stack it on top of not hydrating enough or the other things, then it can make this thing get more aggravated. So if I'm going to have someone change their pH, the first thing I do is get them to understand that if you ever want to grow a bacteria, you have a petri dish and you have water and you have sugar and you culture or grow a bacteria. So sugar is really acidic, so is alcohol, so are carbohydrates, all the fruit juices, dried fruits, all those things are really acidic. Also, a lot of high spices are really acidic. So when people don't realize that what they've been doing is growing bugs in their system, they don't realize that that pattern has been established so long that the ability for those bugs to reoccur time after time seems to be inset in their body. And a lot of people say that they've never been able to get rid of them. They've had them for 10 or 20 years. Well, the other thing I want to address, and it's not that antibiotics are bad, but if you've taken antibiotics more than a few times and you've repeatedly used them, you're now culturing some bacteria that probably are more resistant to the antibiotics, and you either have to take more or different antibiotics or for longer periods of time. Every time you're taking an antibiotic, you're killing the healthy flora in your gut, and a lot of women know this, and so they take healthy bacteria afterwards. It isn't really enough to get the gut refluoridated. It isn't really enough to get the whole body to digest and absorb well. So the first thing that you need to do is you look at the list that'll be on the website of the acidic and alkaline foods, but the easy answer is fruits and vegetables, in almost all cases, are your most alkaline foods. There are exceptions. There are fruits and vegetables that are a little more acidic, but we're also talking about how things are prepared. So if you're used to having lots of vegetables and you're using high spices like black pepper or red pepper or any of the spices that are really acidic, you'll find that, or you're sauteing a long time in oil and high heat, you can take an alkaline vegetable and you can make it acidic. So the important thing is when you're having your fruits and vegetables that are more alkaline to change your pH, you need to make sure that they're as close to the way they were originally. I'm not saying eat raw, but it would be lightly steamed with a minimum amount of seasoning, especially staying away from the really spicy things that are really acidic. So anything that dries your mouth out or makes you dehydrated or makes you thirsty or your lips are really dry, then you're probably having something that's acidic and dehydrating you. If for women, since we're addressing this mostly to women, If your lips are dry and if you have to use lip balm or lipstick all the time, then you can figure that you're dehydrated. And you can figure that if you're dehydrated here, then you're dehydrated throughout your entire body. Once you do that, then you are starting the whole cycle again of allowing the bugs, the bacteria, to replicate or have babies sooner and faster. So if you're going to eat a diet that's more alkaline, how alkaline should you go? If you've had chronic bladder or urinary tract infections, you probably should try for a period of time to go 80 to 90% alkaline. And if you need to, if you're actually having bleeding or a lot of discomfort, or if you're having an infection every time you're having sex, you might, for a short period of time with supervision, you might want to go 100% alkaline. But there's always cautions, because if you're a woman that's having trouble maintaining her weight and chronically underweight, you don't want to go on a diet like this because you're going to lose weight very quickly. So you have to be careful. You need to seek appropriate help for that. But if you are trying to correct an acute condition that's really giving you a lot of problems, 100% for maybe 3 to 5 days would make you more alkaline very quickly, and would allow your immune system to tune up and the pathogens to start having as many babies, and it would start to shift that balance. Then you want to look at a maintenance diet of probably 70%, and you may have to make it even 80% of more alkaline, which again, fruits and vegetables. And then you'll have to figure out if there's any foods that are particularly, so you may say, well, I'm only having right now 20% of my diet that's acidic. But if you're having peanuts, or you're having, most nuts and seeds seem to be pretty aggravating for people that have that. So you have to find out which foods you're having that would be even more acidic or causing more of a drying, dehydrating reaction in your body. And that will require sitting down with someone that knows what they're doing. But that's why if you're having the fruits and vegetables as your primary diet, and then if you have an animal product that you know works for you, beef, fish, chicken, but again, preparation is part of that, then you can probably start to shift your pH fast enough so that the pain, discomfort, symptomology will go down. I think the most important thing is to figure out which foods you're eating on a regular basis, because truthfully, I think that if you look at your food intake, the foods that you like the most and you eat the most frequently are probably the acidic foods. Those are the things that we all tend to like. And so it could be a carbohydrate, it could be a certain kind of fat with a lot of, most people have rancid fats and don't even know it. So if you're having healthy fats, which are anti-inflammatory, that would be good. But fat, salt, and sugar are the addictive tastes, and those are the ones that people go for. So that the fruits and vegetables usually don't taste as good if you don't have more of the fat, salt, and sugar component in there. So I think that if you go through your diet, keep a dietary log, look at the foods that you repeatedly eat, there's going to be something in there that's allowing these bacteria to grow very quickly. The last thing that I think helps is if you have a qualified practitioner and you've been self-medicating with something like cranberry juice, you'll find that they want to do some support work for rebuilding the mucosa so that that tissue can heal. And yes, anti-inflammatory things like healthy fats, vitamin E, etc. are really good, but the diet that you go on can be tuned correctly so that you can actually repair the mucosa. Because once that tissue has been scarred over repeatedly, it becomes a potential site for future infections. And what you want to do is not only stop the current infections, but then you want to go in and resurface, remodel, remake that tissue so that it has healthy elasticity. And that applies to the fact that a lot of women, once they've had repeated infections, will say that they have a little bit of urinary incontinence. So they have stress incontinence when they cough, when they sneeze, when they move, sometimes during sex, they'll find that they have a little leakage. Well, that's because the repeated infections scar some of that tissue, and when that tissue scars, it's lost some of its elasticity, and it doesn't respond as well. So this will address all those issues, especially women that have delivered babies and have some of that incontinence. When they learn how to eat a diet that feeds the tissue and makes it more healthy, they'll find that they can get rid of those symptoms, and that's a relief for many women.